I'm Amy Osoria. I'm a doctor of physical therapy and owner of Free Range Physical Therapy. I am currently on my 4th pregnancy, and I have been experiencing some of the pregnancy pains that we get used to as we stretch, and especially this being the 4th, you feel it more and more each time. So I'm 20 weeks right now, and I'm starting to get that round ligament pain right here, and it's actually referring to my thigh. And then also I've experienced the low back pain starting at about 18 weeks, which is normal. But in order to help some of these pains, there's a really basic exercise that we give in physical therapy, and also for just with anybody with low back pain, but it's a really basic exercise that everybody should know and they should use as a base for any other exercise they do. Now, before you start any exercise, it's best to make sure you check with a doctor and make sure that everything is safe and everything's going good with the pregnancy. But if you're experiencing back pain, there's definitely things you can do. It's best not to just lay around and let it hurt you, because the more you try to move and get up, it's going to get worse and worse. Also, once you learn this exercise, you learn how to brace. Anytime you're going to sneeze, cough, laugh hard, if you brace yourself, you can avoid a lot of that pain that comes along with the 2nd trimester of pregnancy. So this exercise is called pelvic tilt, and the goal is to be able to tuck your pelvis. And it's not a natural movement that we're used to doing. So we want to focus on this part of your back and flattening it. So you're going to flatten your back. And typically we do this laying down. If you're starting, it's best to do it on a kind of a firm surface so you can feel if you're doing it correctly. So you're going to lay down on your back carefully. And if you want, you can put 1 or 2 hands underneath the low back, right at the tailbone, right on that triangle part of your tailbone. And so what you're going to do is you're going to squeeze and flatten. You're just going to try to squish your hand, but you're not going to use your legs. Your legs are relaxed. You're going to use these lower muscles in the abdomen that we sometimes call the corset muscles because they hold everything together. So you're going to squeeze, hold it for about 5, and then relax. And then squeeze, and you can feel these deep muscles tightening. And relax. And generally I'll hold it for about 5 seconds and do about 20 at a time. And if you get really good at it and you can feel these muscles tightening and you can tell your legs are relaxed, we don't want pushing with the legs because that's going to cause too much work. We just want these abdominal muscles. But once you get good at it, you don't necessarily have to be laying down every time. You can sometimes when I'm driving, I'll just kind of work on it. I'll tighten it and relax. And just do that throughout the day, and what it does is it helps stimulate those muscles to hold everything together. That way when you change positions, when you get up too fast, your body will start to remember that and do that before you even plan to do it. And that'll just make everything feel so much better. And if you know anybody with pregnancy pains or even with low back pain, this is a really good core exercise. As you do other exercises and you want to get in shape, you always remember to do that pelvic tilt and tuck everything in and make sure everything is together before you start, and that'll take care of a lot of pain. Again, this is Amy Osoria with Free Range Physical Therapy.